Hello everyone, I am Dr. Radhika, consultant obstetrician, gynecologist and laparoscopic surgeon at Medicava Women and Child Hospital, Madhapur. Today we will discuss about what is the effect of eclipse on pregnancy. See, there are so many myths we are having about eclipse and so many myths what we have to follow in pregnancy during eclipse. So the main myths which we are having right now are, one thing is where the pregnant woman should not go out, and they will be inside indoors, and they have to close all the windows, and they have to stay in dark room. That is one myth. And second myth is, so they should not consume any food, they should not consume any water. That is the second myth. Third thing is, they should not use any sharp objects, they should not use knife, and this is the third myth. And fourth one is, if you expose to the eclipse, then there will be congenital anomalies to the baby will be there. So these are all the myths we are having. We'll just discuss whether what is the how much care we have to take, or what is the scientific evidence behind these myths. So first one. So when you take the first one, even when you are when the non-pregnant people also, when they are going out and they'll go out, and usually they are not, usually scientists also, they say you should not see the eclipse directly. So some amount of X-ray film or some film should be there, and then only you have to see the eclipse. So in a similar way, maybe there are some UV radiation or some radiation is there which may affect the eyes. So in similar way, pregnant women also, if suppose they are staying indoors, it's okay. So they'll not get exposed to the UV radiation, or they'll not get exposed to the radiation. But there is no scientific evidence that this exposure to the eclipse will lead to congenital anomalies. No. So usually by the end of 3 months, all the baby organs are formed, and usually there is no scientific evidence that the congenital anomalies will develop when the pregnant woman is exposed to the radiation. Coming to the consumption of food and water. So during eclipse, people say you should not consume food and you should not consume water. Just when you discuss about this, what may be the reason behind why people say why this opinion is being carried forward over the time means, so usually during eclipse time there will be some temperature drops can be there, and sometimes light also gets faded. So during that time, because of the drop in the temperatures, if the already prepared food, there may be a hypothetical development of any infections can be there. So it is better to avoid, but pregnant women should take food during eclipse. They should not be in fasting for the long hours, because it causes hypoglycemia and dehydration. Hypoglycemia, dehydration, both are not good for the baby, and they lead to sometimes even when baby movements also they can be decreased, and dehydration also can cause some urinary infections. So if you want to take food, you can take freshly prepared food, and don't avoid water during this thing. And regarding the congenital anomalies, I told you, so in the congenital anomalies, it's all myth only, right? We don't have any scientific evidence during this. So I advise all pregnant women not to fear too much about the eclipses, and only the things which are important is, if you are staying indoor, yes, it is advantageous to you. So you are not getting, if suppose any radiations or any unknown unknown radiation which is being emitted during eclipse, you can avoid. But if emergency comes, it doesn't mean you have to sit at home. So if emergency comes, definitely you can come out taking precautions. You should not see the eclipse directly. And second important thing is, take adequate water and food during that time, and even also you will get the rest if suppose you are staying at indoors. Take all these precautions, then no worry, no fear about any congenital anomalies during eclipse.